So this is a repeat of a study that Kathy showed, but I'm just going to remind us of one of the primary reasons why we did the FACES study. One is that there's very little data on which to know which asthmatics are susceptible to air pollutants, if everybody is equally susceptible or certain factors make you more susceptible. And we also wanted to explore in detail air pollutants that haven't been studied with respect to exacerbations of asthma. And as you can tell from the talk on what kind of information we collected on exposures, we did look at a lot of things that other studies haven't looked at. There's also no data on the relationship between the responses to short-term exposures and the long-term progression of asthma in children. And of course, we picked Fresno because it has very high levels of ambient air pollution. You've learned a lot about that today. And also some indications that there's a lot of asthma morbidity here, especially with things like hospitalization. So this is who was in the FACES study. Our study population consisted of children who were 6 to 11 years old at entry and had a physician diagnosis of asthma and evidence that they had had symptoms in the past year, medication use in the past year. To answer the recruitment question, I don't remember who asked it, we recruited in a variety of ways, anybody in any way we could, but we did a lot of recruitment through schools and through TV and radio ads, and those included Spanish language stations. And also used word of mouth, anything we could to get people into our study. So it's not a random sample, it's a convenient sample that we then followed over time. The principal study aim was to evaluate both the short and long-term health effects of exposures to ambient air pollutants and bioaerosols, and to look at how they affected lung function among children and progression of asthma among children with asthma. Here's some characteristics of our cohort as a whole. The mean age at baseline was about 8 years. We had more boys than girls, about 57% boys. Our incomes were fairly well distributed, with about a fifth of our households having incomes less than $15,000. Most of our kids were either Hispanic or non-Hispanic white. And then we also had about 16% African Americans. The one way we were very different than the Fresno population was in our percent of Asians, and those were much lower than they should have been relative to proportion of Asian children in Fresno. And about 63% of our children were skin test positive to at least one of the antigens that we tested for, and I'll show you those in a minute. So today I'm going to talk about two different studies that we did for FACES that both looked at air pollution and wheeze. The first one that I'm going to talk about is looked at short-term increases in air pollution for criteria pollutants, and specifically we wanted to know there were subgroups that were more vulnerable, and in that project we used central site exposures as our estimate of the child's exposure at the super site. The second project I'm going to talk about looked at how short-term increases in PAHs affected wheeze, and we wanted to know if certain PAHs were associated with greater effects. And in this particular project, we also were able to compare what happened when we used those central site exposures versus when we used our individual exposure estimates that Kathy talked about. So first, talking about the subgroup study, we wanted to know if there were subgroups of asthmatic children who were more likely to wheeze from air pollution. And we were especially interested in subgroups of atopic asthmatics. And the people that were included in this analysis were children who had completed at least one of those panel visits by March 2005. The panel visits were where children gave us 14 days worth of spirometry data in the morning and in the evening. The spirometer included, had into it questions about their symptoms, including wheeze. And this analysis was looking at whether or not a child in the morning had wheeze since they had gone to bed. And there were 280 children in this analysis, and that included more than 13,000 observations. And we were interested in the relationship of exposures in the past 2 weeks to these criterion pollutants: NO2, the coarse fraction of particles, which is the ones that range in size between 2.5 and 10 microns, PM2.5, elemental carbon, nitrate, and ozone. And as I said before, these were all measured at the supersite in Fresno. This slide shows all the different things that were included in our allergy skin test panel. We looked at fungi such as Alternaria and Cladosporium. We looked at trees and grasses and things that would commonly be found outside in Fresno. And we were specific to include things that would be found in Fresno. We also looked at house dust mite, cat, cockroach, dog, things that could be represented inside as well. And you can see that in particular, Alternaria and some of the trees and grasses were especially common things for our kids to be skin test positive to. So I'm going to skip over how we did our statistical analysis and all of our different methods and just talk about what we found. So remember, we're looking here at what happens in different subgroups. So the first thing I'm going to talk about is what happened in the full group. So in the full group, we found for all pollutants other than ozone, elevated wheeze. But for 2 of them, we found what we call a statistically significant effect. And those were for NO2 and the coarse fraction. And so the odds of wheeze was elevated in both, and statistically significant has to do with how precise we think our estimate is. And we adjusted for a number of things. We adjusted for different characteristics of the children, including demographic characteristics. We also accounted for the fact that we had repeated measures in our analysis, and we accounted for temporal and seasonal trends in our outcome. So what subgroups did we consider?
Jennifer,
yeah.
Can I just back up one? I think it's kind of important for people to understand. If you could do it, I know I asked you not to get too much into stats, but could you just talk real quickly what an odds ratio of 1.1
Right.
would be?
So, and I also skipped over something more at the top of that slide, but we were really interested in looking at what happened with realistic changes in air pollution concentrations for Fresno. So the first step was we determined what we thought would be a realistic increase in air pollution. So we looked at all the increases over time, increases and decreases, and came up with an increase that happened at least 10% of the time. And so for NO2, I think it was about something close to 10 ppb. And so when you increase NO2 by 10 ppb, the odds of wheeze increases by 10%. And when you do the same thing for coarse fraction, you find a pretty similar increase in odds of wheeze. So what this is looking at is it's basically coming back to what the probability of wheeze is with one air concentration versus another air pollution concentration. So that's a good way to sort of interpret this. So we were interested in looking to see whether or not being skin test positive to any antigen or being skin test positive to any one of these specific things that I talked about was important. Did it affect how you responded to air pollution? Was asthma severity important? We actually used something called the Global Initiative for Asthma, which has classifications for asthma severity to classify each of our children at baseline, and we looked to see how that might affect their responsiveness to air pollution. Then we looked at income level, whether or not they had different kinds of pets, and their race and ethnicity. So I'm only going to present some of our results. I'm going to present the ones that jumped out. There were 2 subgroups of atopic asthmatics that were more responsive to air pollution. I'm going to show you how in a minute. But they were the children that were allergic to cat dander and children that were allergic to either or both Alternaria or Cladosporium, which were the 2 fungi that we had in our skin test panel. And then we also found what we call a